Hello everyone, my name is McKenna Hubbard. Today I'm going to be teaching you CPR with the use of an AED. After this video, you should be able to effectively do CPR with the use of an AED, correctly placing the pads, and you should be confident in your ability to do CPR. So, before we begin, there's a couple things that you need to remember about this patient once you come upon him. Anytime you come upon an unresponsive patient, you're going to want to try to get them to respond to you. Okay, so you're going to do a sternal rub. You might pinch in between his clavicles. You're going to ask him, hey, are you okay? Can you respond to me? Once he does not respond to you, you're going to know that you need help, right? So you're going to request assistance. You're going to ask someone if they saw anything, try to get some information. You're going to go ahead and then check your pulse and breathing simultaneously. You're looking for chest rise and fall. You're feeling for the pulse. The second that you determine that he is pulseless, you need to begin your CPR. You're going to go ahead and request an AED to come to you as well so that you could get that extra help, okay? So when you do your compressions, it's important to remember that you're going to go at a 2-inch depth and you're going to allow the chest to fully recoil, which means you're going to allow it to come back up to its normal state. The reason that we do this is because if you're only going like 1 inch down, you're not going to really pump the heart fully, and if you don't allow the chest to recoil, then you're not going to allow the heart to come up fully, right? So we want those full compressions. We want to move this blood around the body as effectively as we can. We don't want the half heartbeat, because then we're going to be doing a bunch of work for only half the results, right? Okay, so then once we get that, we're going to remember the ratio 30-2. So I'm giving 30 compressions to 2 breaths. You usually would have like a pocket mask right here to administer your breaths. I don't have one today, so I'm just going to go ahead and pretend that there's one there, okay? I'll just go a little bit farther away from the mouth. So 30-2, then you're going to immediately resume compressions. You're never going to stop compressions for more than 10 seconds. Okay, I'm going to go ahead and demonstrate a couple cycles for you guys. You're going to give 1 breath over 1 second for both of your breaths. You want your compressions at just the right pace. We're looking for 100 to 120 beats per minute. Okay, so once you get your AED, you're going to make sure that you're finishing your 30-2 cycle, and then you're going to ask somebody to come and resume compressions for you while you get your AED prepared. The most important thing to remember with this AED is to turn it on. It will tell you everything the second you turn it on. So there's also pictures on the pads to let you know where they go. So this one's going to go on the patient's right side of their chest right here, and this one is going to go on the patient's side. I always just try to remember that the shock is going to be going through the heart, okay? So then I'm going to go ahead and turn on my AED.
Apply pads to patient's bare chest.
Okay, so we did that, right?
Plug in pads connector next to flashing light.
Check.
Analyzing heart rhythm.
So you want to stay clear.
Do not touch the patient. Shock advised. Charging.
Stay clear.
Stay clear of patient. Deliver shock now. Press the orange
Shocking,
button
you're clear,
now.
I'm clear.
Shock delivered.
Okay,
Paused.
so then you're going to immediately begin your CPR. All right, thank you very much for watching this video. I hope this helped. Go out there and save some lives.